my powerful posse, and welcome back to my channel, Purple RX. I'm Renata, your friendly and resourceful PharmD, here to help you navigate this health and wellness world with all this information, with everybody telling you this is what you need to do, this is what you have to do. We're here to find out what is exactly for you, because everything is not for you, and you aren't for everything. There should be something exactly for you, and I'm here to help you find it. I'm here to help you see how to really look at what's for me. How do I know about my body? What's important to my body? And where do I know when to say no, when to say yes, when to say go, when to say stop? So today, you know, is Mondays. So we're still back on our mineral Mondays. We only have a few more minerals, but today we're going into zinc. Zinc is something that's been talked about amongst people in the natural community, as well as other doctors in this time of COVID, as something that you should take because zinc is very important to your body. It's an essential mineral naturally present in some foods, and then it's also fortified in some others. It's involved in different parts of cellular metabolism and dietary supplementation. So it's required to increase the rate of over about 100 enzyme reactions. So it basically catalyzes or increases the rate and allows that reaction to go faster, allows that reaction to happen and really do its thing. It plays a role in immune function, which is why they're really talking about it now. Protein and DNA synthesis. So in order to make proteins, and proteins are a part of DNA, in order to make both of those, you're going to need zinc. Wound healing, also in cell division. So basically making babies, making new cells, new skin development, any kind of cell within your body that needs to be renewed, it's a part of that. It supports normal growth and development during pregnancy, childhood, and adolescence. So it's needed for growth. It's growth of hair, growth of all those things. It's required for proper taste and smell, which is why some people may be having issues. It might be. I don't think they've quite looked into it, but might be having issues during this time of COVID, especially due to this virus because of taste, smell, and daily intake is needed to keep maintenance because there's no specialized storage form for zinc. So we need to take it in daily. The recommended daily amounts, I will list those and actually put those up. As you can see, the recommended daily amounts are different for pregnancy and lactation for men and women. As you grow older and as you age up, you will see you'll need more and more and more zinc. You'll find zinc in food sources, mainly a lot more meat sources. So things like 3 ounces of oysters. Oysters is one of the highest ones to have zinc, and beef chuck roast, crab, beef patties, chicken, mainly the dark meat, lobsters, pork chops. You'll also find it in a half cup of chickpeas. Of course, they fortified it. They fortify cereals with it. So any cereals, Cinnamon Toast Crunch, all of those cereals that you see, Lucky Charms, Raisin Bran, whatever cereal that you choose, it's going to be in those, as well as those little instant oatmeal packets. You'll see it a lot of those, as well as pumpkin seeds and some other veggies and seeds that you'll find zinc in. Now, zinc deficiency is going to be related to a growth, basically stunting in growth retardation, a loss of appetite, or impaired immune function. In a lot of severe cases, you're going to have hair loss, diarrhea, delayed sexual maturation, impotence, decreased testosterone production in men, and eye and skin lesions. You can have that. Also, you're going to have weight loss issues, so you're going to be losing more weight than you should. Delayed wound healing, because like I said, it's important in wound healing. Mental lethargy, so basically mental fog, mental fatigue, brain fog, or taste abnormalities. So things of you may not be able to taste it, or something may taste funny. It might be due to insufficient zinc within your body. Now, zinc is very difficult to measure because it's not just free flowing in the blood. Like, you're going to have it in your protein, your DNA. All of it is going to be in different places doing different things and a part of so much right now. The growth of your cells, the development of your cells, the breaking of your cells. So at every level, zinc is a part of it. So it's really kind of hard to measure. So most likely what you're going to see is people measuring the plasma or your serum zinc levels in order to see if you're deficient in zinc. And most likely you won't always get that from a regular doctor. There are people out there with certain metabolism sensitivity tests and certain tests of mineral content, as well as an alternative health doctor. So that could be a naturopath or chiropractor or somebody along those lines. They'll most likely be able to help you and be able to find that out for you. So deficiencies are usually due to like an adequate intake. Maybe you're having some kind of absorption problems. Say if you have some intestinal issues, lower intestines, small intestines, large intestines, if you have any issues in those areas with absorption, or you're getting an increased loss because of increased urine output, or you're not getting what is nutritionally required for your body. So those are the main reasons that you'll see people having low or having a deficiency in their zinc. Now, vegetarians, vegans, they need more zinc, 50% more zinc, because they're not really eating meat. And a lot of our zinc sources are from meat. Now, if you're eating, and a lot of vegans and vegetarians I know, they aren't really eating a whole bunch of processed foods. So a lot of processed foods are going to have it fortified and added to it in order to get the daily value that you need. And because the American diet is so crazy right now, it's so crazy because there's so many different diets and there's so much different information and there's so many different regions that don't have access to certain things. And there's so many people that have just learned poor habits and have poor relationship with food, that you're going to find a lot more zinc issues than we think there is. Now, vegetarians and vegans, they require 50% more because of no meat, as well as they eat more legumes or like beans and lentils, things like that, and whole grains, and those produce phytates. And phytates bind to zinc and they inhibit the absorption of zinc. Eating more like leavened bread and taking supplements will help to increase that zinc. But even if you don't want to eat leavened bread, check out supplements. Supplements are definitely going to help you get more of the zinc that you need, more that you require. You can find it in lozenges, maybe I'm not saying that right, cough drops, things like that, cough syrups. But there is supplementation for vegetarians and vegans. There's a lot of multivitamins that make sure to have these things that are necessary. Also, who might come up having a deficiency in zinc, 30 to 50% of alcoholics have low zinc, but they also have a lot more. They have a lower mineral content and a lower vitamin content within their body because of depletion, because intestinal absorption goes down, because your body's trying to work out this alcohol and get it out of the system, and excretion is increased because when you drink alcohol, your body is wanting to get that toxin out of your body very quickly. So you're going to have increased excretion. Low zinc is also associated with impaired immune function. So you'll have a decrease in your macrophages and neutrophils and the little mini cells that help when infections come in to fight it, to kill it off, to do those things. It is also needed to develop T lymphocytes. So those are T cells. T lymphocytes are like T white blood cells, are your T cells. And those are ones that are helping to fight off infection, build up that immune system. That's what they're talking about now, T cells and B cells. So in those areas, zinc is important and it's needed to develop those T cells. So low zinc leaves you susceptible to infections, and it also helps to maintain that skin and mucosal integrity. So think about this, if you're low on zinc, your skin is not going to be the same. Your skin may have a weird absorption or the mucosal integrity. So things like stomach lining, the mucosal lining within your mouth or in throat areas, in esophageal areas, that integrity will be gone. And you're more likely to maybe even get ulcers with inside, just like you're able to get more skin ulcers because your skin integrity is taken away due to that. It's reduced due to low zinc. The use of zinc helps to reduce the severity and duration of colds and cold symptoms. And the common cold is a virus. So like what we're going in now. So it directly inhibits rhinovirus. It binds to it. It directly inhibits rhinovirus binding and replication in the nasal mucosa. So it'll inhibit it from basically fully binding to your nasal passages and in the back of your mouth. That's why when you go see somebody, it's an ear, nose, and throat doctor, because they all come back in this area and meet together. So it inhibit that, and it inhibit that the replication and the mucosal, and it's spreading in those areas, which is most of the time when you're getting a cold, nose, throat, ears, they all connect. So, and it suppresses inflammation. So things that help are zinc lozenges. You'll find elderberry lozenges with zinc in them or cough syrups with zinc in them, because the actual zinc, of course, inhibits the replication and it suppresses the inflammation. And the reason it's lozenges and syrups, because those are a little bit thicker agents and they're able to stay in that area so that zinc can mount up and do its job. And so say, well, how do I go if I'm taking excessive amounts of zinc? An excessive amount of zinc is usually 80 milligrams to even 450 milligrams a day. So if you're taking that chronically on a daily basis, you might be doing too much. And your body's gonna let you know you're doing too much by showing you through nausea and vomiting, loss of appetite, abdominal cramps, diarrhea, headaches. I know that sounds just like some basic everyday virus that you may have, or some issue that you may have. Or so maybe you ate something wrong and it sounds just like that. So we have to be careful, just because, and I really believe that's why the CDC, a lot of people haven't come out and said anything. That's one part. That's not the full part, because they can't say it and give the proper information, because they don't want to be liable if somebody says, well, I took zinc, and they took an excessive amount of zinc every day to mount up their immune system, and next thing you know, they're having these side effects, or they're having issues where they're having nausea, vomiting, diarrhea, abdominal cramps, all of that issues. And they're gonna be like, well, they told me I had to take zinc. But our system should know these are the milligrams that we can say per day how much you could take, because an excessive amount can do certain things. But zinc is essential to your immune system, and it's essential to your body. And if you are in this time of COVID and watching in this time of COVID, make sure your body has enough. So make sure, if you come up with a cold virus or anything, get you some zinc lozenges. Make sure those lozenges are like elderberry with zinc in it. Those are quick, effective, and help. Get a syrup with zinc in it. But to continually give yourself zinc to prevent something from happening, they can't guarantee that, and they can't say that it's gonna work like that for everybody. So So that's probably why they're partly not saying it. But everybody should make sure that they are getting enough zinc out of these foods, whether it's meat or whether it's chickpeas or something else, or a veggie, or eating a fortified cereal, or taking a zinc supplement. Now, things you want to watch out for when taking a supplement, of course, if you're taking some other medication or another supplement, you will have a few interactions. So zinc supplements, along with greater than 25 milligrams of iron, it might decrease the absorption of zinc. Also with copper, increased zinc use can inhibit copper absorption. So the thing with supplements is it does not react the exact same. It does, your body does need it, but there could be something else going on with your body that you haven't taken care of, that you haven't thought about. Maybe that you're having intestinal problems, so you may not be absorbing it well. There could also be so much more going on that you don't know about, and just to go up and take zinc and be like, I'm good, is not something they can recommend, or they want to recommend, or they want to be put in that position. Back to interact, and it shows, just like I said, having an increased amount of zinc can decrease the absorption of copper, and copper is needed as part of a mineral for your body as well. But we'll get to that at another time. Like I was saying, other interactions are going to be antibiotics. Quinolone antibiotics, which seem like they interact with a lot of things. Quinolone antibiotics, which is your Cipro, your levofloxacin, your moxifloxacin, those drugs, and tetracycline drugs, doxycycline, minocycline, those are going to interact with zinc and inhibit the absorption of both zinc and the quinolone. So if you're taking zinc and a quinolone, it's not going to absorb either one, because they're just going to outright inhibit one another. So it's basically just going to be sitting there not doing anything. So you have to take you have to take it 2 hours, your antibiotic 2 hours before, or 4 to 6 hours after your intake of zinc. Other one you want to think about is if you're on a diuretic, and there's a lot of people on a diuretic, more than you think, not just patients with high blood pressure, but other patients with other edema issues could be taking thiazide diuretics and other diuretics. So thiazide diuretics like hydrochlorothiazide, chlorothalidone, those increase the excretion by like 60%, because the way zinc is excreted out through the kidneys, it's going to increase it. Then the last one, if you have rheumatoid arthritis, penicillamine is another one. That can decrease the absorption and action of zinc. So you want to take the penicillamine either 2 hours before or 2 hours after you take your zinc. So there is an importance for zinc, a big importance in our immune function, in growth, in development, in protein and DNA, in the making of proteins and DNA, in wound healing, cell division. There is such a need for zinc. So the important message is today, make sure you are taking enough. Make sure you have enough. Make sure you're getting enough in your diet, whether you're vegan, vegetarian, whether you don't know what your diet is, or you may not be getting it, or it's maybe taking something that's not fortified. Make sure that this is a part of something that your body is getting, and it's getting in the proper way. However you need to get it. Like I said, supplementation, adding some things into your diet. Mainly, like I said, you're going to get this from meat, oysters, you're going to get that from those things, and then other fortified foods. So don't go out there just running to get zinc because it's coronavirus. The only one I would suggest is taking either lozenges or syrup if you are actively sick. If you are not, you probably could get, just depending on how much meat you eat, you probably could be getting more than you think, and more than your body needs so that it can do what it needs to do. And if you're not getting it and you're eating meat, there could be an absorption problem that you may need to look at more. You could need a probiotic, you could have some polyps. There could be so many different things that could go on that can inhibit the absorption. Maybe you're eating too many fats and messing with, there could be so much going on, but it's something for you to be in conjunction with your healthcare provider and figure out what's for you. And like I said, whether it's a doctor or whether it is a naturopath or somebody of the alternative community, they can help you and they can tell and they can go with you. So I thank you guys. I appreciate you guys for checking me out on this Monday, and you guys have a nice day. Love you. Bye.